15-month-old female patient, 15-old female patient, 15 months, presented with dyspnea and central cyanosis.
Then 15 months تبين with the central cyanosis.
نعم أستاذ.
What central cyanosis mean تبين?
mean central mean cardiovascular causes, maybe the cause in the right to left shunt. ممكن تحرك الكورونا
هذا السيانوسيس
باللبس.
بله. Excellent.
Can you move coronal please, doctor? والأكزيال هسه.
السلام عليكم، مرحبا أستاذ.
Just one more time over the coronal, please, doctor. Okay, so this case is a 15-month-old neonate with CT chest with IV contrast, multiple section. Actually, I didn't see lung view, if you don't mind. See. All right, so we have a CT, multiple section CT scan of the chest of this small baby with the IV contrast, showing small pulmonary vessels, pulmonary vasculatures, including pulmonary trunks and main branches. And I see a possible defect in between right and left ventricle, and also appearance of the aorta just arising from the defect directly, overriding aorta, as well as enlarged right ventricle. And also I see the filling of the contrast in the IVC, in the arterial phase, which indicate a heart failure, right-sided heart failure. So with the presentation of the symptoms and the age of the child in the cyanosis. And also in the lung view, I see somewhat decreased vasculature in form of the oligemic appearance. I thought about the tetralogy of Fallot as the first differential in this situation, which is the most common congenital anomaly in this situation, although the aorta is arise from the ventricular septal defect, as I said. Yes.
So this is a case of TOF.
Yes, that's right.
Tetralogy of Fallot.
Yes.
Regarding the overriding of the aorta, we
Yes.
can calculate the percentage of the overriding. And which modality is best to assess the percentage of the overriding?
Actually, I have no idea about the calculation, how we measure it.
Okay. What do you mean by overriding of the aorta?
Yes, actually, aorta normally should arise from the left ventricle, but in this situation, it will arise from the directly above the defect in between the right and left ventricle, above the VSD, we can say.
So the type of the VSD almost frequent.
We have membranous type and muscular type VSD.
The usual one with the TOF.
I think membranous.
Membranous. Okay.
Yes.
What do you expect to see on chest X-ray?
On chest X-ray, yes, we will see abnormal shape of the heart on first impression on the chest X-ray on the PA view, which is called a boot-shaped heart. Abnormality in the region of the pulmonary vasculature, we will see it appears as a boot-shaped heart, which is called maybe due to the what's called appeared as obturant cardiac apex.
Yeah, elevated due to left cardiac apex due to enlargement of the right
ventricle. Yes, hypertrophy later on will appear in the right ventricle, and this may cause this appearance.
So they call it tetralogy of Fallot because of?
Yes, because we have four pathology. Tetralogy means four pathology. First of all, we will have a VSD, which is a ventricular septal defect. Number two, we will have overriding of aorta. And number three, we will have right ventricular outflow obstruction. That's why we see here small pulmonary vasculatures, because the pulmonary valves is dysfunctional or hypoplastic or abnormal. And four, later on, you will have right ventricular hypertrophy later on in appearance of the child, which may cause a right to left shunt and right ventricular failure or right-sided heart failure, as we saw in this case where we see a reverse of contrast in the IVC.
Okay. Thank you, Tabib. Dr. Ru'a.
نعم أستاذ صباح الخير.
صباح الخير. You agree, I think, with the diagnosis of TOF? Yeah.
Yes.
The most common age of a presentation of TOF depend on what?
Depend on the degree of VSD. On ventricular outflow obstruction. I think depend on resulting in cyanosis presented in neonatal period.
Yeah. So the common age of a presentation was neonatal period. Yeah. What type of management they do for those patients?
يعني surgical management يسوي له repair أستاذ.
Repair for
the shunt. يعني for the يعني يسوي له shunt أستاذ. for pulmonary hypoplasia.
shunt منين يسوون؟ قصدك correction of the SD and the overriding of the aorta.
نعم أستاذ.
مو صحيح؟
نعم.
زين. راوانا دكتور عمر فهمي دكتور عمر راوينا اللنج window.
نعم أستاذ.
شنو دا نشوف فيه الرؤى باللung window of the chest? Is there definitely oligemic lungs?
No, I don't see origami.
There is no oligemic. What we define oligemic lung? شو نقول oligemic lung?
Increase in vasculature of the lung.
Which vasculature? Peripheral, central?
Central vasculature, pulmonary blood volume.
Central increase بينما البريفرال اللي هي distal 1/3 of the lung بالسبكوستال area ما راح نشوف الفيزز، مو صحيح؟ بس هسه احنا دا نشوفها هيك into the flora.
Yes.
فشو تفسرين هاي؟ يعني هو طبعا الكوز اوف سيانوسيس هو الاوليجيميا، مو صحيح؟
ايه.
الاكسجينيشن ده يصير defective oxygenation او incomplete oxygenation of the blood لانه
يعني إذا ال obstruction is minimal, the cyanosis may be inapparent.
من هو هايبوبلاستيك. شنو الكوز مال هايبوبلاستيك بالمونري؟
هو واحدة من التوف، يعني واحدة من ال manifestation مال توف يصير infundibular stenosis أو hypoplasia بالpulmonary valve.
من صح.
يصير obstruction.
اي والاوليجيميا due to يعني deficiency blood deoxygenated blood اللي reaching لللنجز، مو صحيح؟
نعم.
بسبب البلمونري ستينوسيس. طبعا السيرجري مالتها شويه difficult لانه اعتقد بي ستيجز كوركشن مالت البي اس دي كوركشن مالت البلمونري ستينوسيس اذا اوكي. شكرا رائع. نرجع على دكتور عمر. دكتور عمر احكي لنا على الكيس.
نعم أستاذ.
إذا مسويته تفضل.
Okay, أستاذ. 15-month-old female patient presented with dyspnea and central cyanosis, cardiac CT angio showing ventricular septal defect, overriding of the aorta, which is less than 50%, and right side the aortic arch, pulmonary artery stenosis, which is the picture of TOF, tetralogy of Fallot. نروح الدكتور.
تفضل.
Tetralogy of Fallot, it is the most common cyanotic congenital heart condition with many cases presented after a newborn period. Account for 5 to 10% of all congenital heart disease and has an estimated prevalence of 1 in 2,000 births. Tetralogy of Fallot classically characterized by the combination of ventricular septal defect, right ventricular outflow obstruction, overriding of the aorta, and right ventricular hypertrophy. Clinical presentation, the presentation relies on the degree of right ventricular outflow tract obstruction. Typically, this is significant, resulting in cyanosis evident in the neonatal period as a consequence of right to left shunt across the ventricular septal defect. In case where outflow obstruction is minimal, cyanosis may be inapparent, which is called pink tetralogy, resulting in delayed presentation even in adulthood, although this is rare. Association, right-sided aortic arch seen in 25% of cases, pulmonary hypoplasia, arterial septal defect, or patent ductus arteriosus, which termed pentalogy of Fallot, coronary artery anomalies, persistent left-sided superior vena cava. Radiological feature. Plain radiography classically show boat-shaped heart, elevated cardiac apex due to right ventricular hypertrophy, concave pulmonary arterial segment, pulmonary oligemia occur due to decreased pulmonary arterial flow, right-sided aortic arch. Most infants with tetralogy of Fallot may not show this finding. And this is PA chest X-ray showing boot-shaped heart shadow, elevated cardiac apex, right-sided aortic arch, and pulmonary oligemia. Echocardiography. Echocardiography allows direct visualization of abnormal anatomy and remain the primary modality for diagnosis of tetralogy of Fallot. And this is fetal cardiac echo four-chamber view showing VSD and overriding of the aorta, with stenosis of the pulmonary artery. This is another case of tetralogy of Fallot, show overriding of the aorta, VSD, hypertrophy of the right ventricle, and pulmonary artery stenosis. CT scan is useful in demonstrating the complex cardiovascular morphology of tetralogy of Fallot, especially the anatomy of the pulmonary and coronary arteries, as well as identification of major aortopulmonary collateral arteries. CT can be used to evaluate post-surgical changes, example, patency of palliative shunt and complication. This is CT scan axial and coronal view, CT cardiac angio showing VSD and ASD with overriding of the aorta, which called pentalogy of Fallot. And this coronal CT show palliative shunt from the innominate artery into the main pulmonary artery. And this CT of a surgically repaired top patient showing large right ventricular outflow aneurysmal dilatation as a complication, post-op complication. MRI has the great advantage of providing both anatomical details and functional information without ionizing radiation. A detailed assessment of the pulmonary artery is of particular importance because the repair of a cardiac defect without addressing pulmonary artery hyperplasia or stenosis has a poor outcome. The main pulmonary artery or right pulmonary artery diameter should be compared to that of the ascending aorta. A ratio of less than 0.3 usually signifies that primary repair would be unsuccessful, and the bridging shunt operation may be of benefits. This cardiac MRI showing right ventricular hypertrophy, ventricular septal defect, overriding of the aorta, and pulmonary artery stenosis. And this is infundibular jet, stenotic jet, which show as a signal void in gradient echo sequence. Treatment, either primary repair or shunt. Primary repair, which is a total correction of the tetralogy of Fallot, is now the prepared treatment and is usually performed at the time of diagnosis. Shunts are nowadays only performed as a palliative procedure in inoperable cases or to bridge patients until their repair can be carried out, typically in the setting of pulmonary arterial hypoplasia. The differential diagnosis refers to pulmonary artery atresia with VSD, اللي هو يعتبر an extreme form of tetralogy of Fallot. Well, this is case showing pulmonary artery atresia. Second, absent pulmonary valve syndrome, associated feature with tetralogy of Fallot and aneurysmal dilatation of pulmonary arteries. Bellico show absence of the pulmonary valve and aneurysmal dilatation of the pulmonary artery and associated with overriding of the aorta and right ventricular dilatation. Third, with double outlet right ventricle. In this case, showing the aorta and pulmonary artery arising from the right ventricle. It's almost always double outlet right ventricle, almost always associated with VS, differentiated from the top by the overriding more than 50% toward the right ventricle. And هذا التقرير مال yes reference